In April of 2005, at the age of 56, in Wales, Pamela Northcutt learned she had renal cancer. Her daughter, Kate Spall, remembers the moment well.
Her mother had actually died of that same disease at 51, so we were very, very nervous.
From the time she was diagnosed, Pamela waited more than 2 months for surgery.
She went from being a patient with curable cancer to incurable cancer.
It turns out the cancer was not contained within the kidney, as initially thought, and her surgery was scheduled, as Kate puts it, without any sense of urgency on the part of NHS doctors.
During that time, it spread into her system. So she became a terminal cancer patient through waiting in the NHS.
After 2 operations, the hurt deepened when Kate began fighting to get her mom a restricted drug that Kate says might have prolonged her mother's life. Her plea to the National Health Service:
"This is my mother and she's amazing and she's 56 and I don't want her to die. And there is a treatment here that is going to help her. Why can't she have it?"
It took 9 months to win the battle for the drug, sorafenib. That was May 2007. 3 months later, Kate's mom died. Now, Kate Spall runs the Pamela Northcutt Fund, helping other cancer patients gain access to the drugs their doctors say they need. Expensive drugs not authorized by the drug rationing watchdog, the National Institute for Health and Clinical Excellence, NICE for short.
Because I face patients every day that come to me and say, "I'm dying, there's a drug that may help me, and it's been denied to me. What now?"
One reason they need Kate's help is the appeal process.
A nightmare, a bureaucratic nightmare. I mean, the amount of patients that spend the last months of their life fighting for their life is unbelievable.
A standard line from NICE is on display in this letter, denying a cancer drug to a Kate Spall client. It reads, quote, "This may seem harsh for individuals, but the PCT, the Primary Care Trust, has to balance the cost of individual treatment against the needs of the wider community." Those words make Kate Spall angry.
We know they're terminal patients, however, they deserve life-extending medicines. And this has been the blocking point the whole time. They're sort of saying, life-extending, not cost-effective, not going to do it. And we're saying, hang on, there is a value to that end-of-life process for patients, because patients just feel they've been put on the heap.
So, with no medical training, no legal training, and spurred on by the memory of her mom, Kate Spall battles for those often too weak to fight for themselves.
I'm getting about 2 patients a day at the moment contacting me that have been denied treatment, and it's just unsustainable. You know, you can't treat a country like this. You cannot treat the most vulnerable people like this. They are the ones that can't fight for themselves.
In early March, NICE announced it would not pay for 2 high-end drugs for stomach cancer and advanced breast cancer, saying their use would not be cost-effective. This is Gene Randall reporting.